Hey, this is Betsy Barnicastle, and this is my response to Module 5 um, discussion question. So on the task and relationship activity, I scored 16 out of 17 respectively. This was in the high to moderate range for both, and based on that information, I have a good balance as a leader. I do function better within rules and regulations, and I like to keep a list of things that need to be done. I also like to keep a short-term list of things that I have accomplished as well. I feel like that I'm able to communicate well with others, share information, and find out what others need. If a coworker seems overwhelmed or frustrated, then I will ask, what can I do to make this better? And when I ask that, I really mean it. Um, Communication, I feel like I'm a good verbal communicator if I'm not under pressure. If I'm under pressure, I can get a bit flustered and I don't think on my feet very quickly. It takes me a few minutes to kind of process what I want to say and make sure it comes across effectively. I am, I do feel like that I am an excellent communicator when it comes to writing an email, but that's because I don't have the pressure and time constraint. I am able to think about what I want to say and make sure I have all my bases covered. The problem with email is that the message may not always say the same thing to people. As our book stated, in the book Leadership and Management in Nursing, the book stated that the meaning of words reside not in the message, but rather in people who interpret the message. With email, one is not able to observe the nonverbal behaviors such as facial expressions, pauses, or gestures. So again, with email, I can say what I want to say, but I'm not assured that everybody is going to read it the same way because people, I guess, read that differently, read into things, you know. So it's not always the most effective, but it is a good way to communicate. As far as delegation goes, I find it hard to delegate to others. I always have. I've been a nurse for 24 years, and I've worked in a lot of situations where I work pretty independently. I have worked in emergency room, outpatient surgery, home health, areas like that. And presently, I work in a surgeon's office, and I'm the phone triage nurse, um, as well as a liaison between the surgeons and the clinical staff in the hospital, or surgeons and other surgeons or physicians outside of our office. I also do a lot of paperwork. So there's not a lot that I could delegate to the LPNs and our CMAs. But if there is, 9 times out of 10, I feel like I have more time to do it than they do. They're in clinic, running clinic, trying to get patients seen in a timely manner, keeping their surgeons happy, doing procedures. So I feel like I can kind of handle what I need to do. Um, and I have, worked in situations where delegation was necessary, as far as working in home health and delegating to the nursing assistants certain tasks that needed to be done. We did supervise the nursing assistants and the LPNs. So I do delegate. I don't, it's something I've never been comfortable with. I don't know why. I delegate at home certain tasks and chores to other family members, and I do that routinely. But if I have to ask more than a couple times or listen to lots of excuses, then I would just rather do it myself. So it has nothing to do with about it being done a specific way. I guess I just don't like the confrontation. If I were leading an interdisciplinary team, I feel that communication would be essential as we work towards the same goal. It would be important to have weekly team meetings so that all disciplines can share how they are making progress towards the same goals. As the leader of the group, I would have an agenda for the meeting and follow up with the written summary after the meeting. so that we can see how we're progressing towards those goals. It would be important to keep everyone on task during the discussion, and delegate activities to the appropriate people if I was leading a team. Being that I do have a strong sense of emotional intelligence, I would be able to tune into body language and facial expressions and get a pretty good understanding of people understood what we were talking about, if there was questions, if there was facial expressions of concern. I also am aware of my own emotions, which is part of being emotionally intelligent, and I feel like I'm able to compartmentalize my emotions when needed. That does not mean I don't have emotions. I think part of that is just being a nurse for 24 years and working in a lot of different settings. I can put the emotion aside to get the task done that needs to be done. Because if you're working in the emergency room and you have a patient that's in critical condition, or you have a child that comes in that's a near drowning, yes, it's easy to be emotional, but if I'm emotional, then I can't do my job to help that child or that person. Same thing goes with being in the surgical area. It's easy to get emotional, when we diagnose somebody with cancer, or we have somebody in the recovery room that has a major bleed. But again, to get the job done, you've got to learn to compartmentalize those emotions, and then also figure out a way of how to deal with those emotions after the work is done. So I do think being a nurse for 24 years has helped me definitely develop a significant amount of emotional intelligence. So as far as leaders with emotional intelligence, I'm just thinking of two leaders that I've worked with. Both were in the surgical area. One was the manager over the pre-op and recovery area of an outpatient surgery center. So outpatient surgery, of course, is a very quick pace. In pre-op, you're getting your patients back, doing your paperwork, signing consents, starting IVs, giving medications, doing the prep, patient family teaching, and getting them into the operating room in a timely manner, and all of that's done within a very small amount of time. Recovery rooms, the same thing. They come to recovery. You've got certain tasks, things that need to be done. So it's important to be able to work independently, and we do help each other when needed. But thinking about the manager of that unit, she was not warm and fuzzy at all. She was very task oriented. This needs to be done, that needs to be done. There's assignments. It just, and that's just the way it is. And I think it takes that type of personality to manage a group of nurses in that fast-paced setting. My current nurse manager as well, she came actually from an emergency room, and she manages all the clinical staff for our office, and there's 22 surgeons in our office. So if you can imagine having to be accountable to 22 surgeons as well as all the clinical staff. There are no warm fuzzies there either. Again, very task oriented, making sure people are where they need to be, doing what they're supposed to do so that the patients are taken care of in a timely manner, safely, the surgeons are happy, and that there's no complaints. So I think that's very different than maybe a manager that was a floor nurse or over hospice or home health. There can be a little more, I don't know, and I hate to equate emotions with time, but sometimes that's what it is. It doesn't mean you don't have emotions. You just have to know when to show those emotions. And I think that is a sign of emotional intelligence too. I would say probably those leaders were emotionally intelligent because they knew how to manage the emotions to get the job done. Thanks.